Hello, everybody. I'm Dr. Sharma. I'm the scientific director of Obesity Canada, which is Canada's large health charity that focuses on improving the life of Canadians with obesity. I'm also a professor of medicine at the University of Alberta here in Edmonton. And I do a lot of research in obesity, but I also work in our bariatric clinic, which is a clinic that offers all kinds of treatments for severe obesity. We have behavioral interventions, we have medication that we'll talk about, and of course, we also offer bariatric surgery. Now, the topic of today's webinar is really to focus on this whole notion around why obesity is now being considered a chronic disease. When you think about chronic diseases, uh, we think of conditions like type 2 diabetes or hypertension or chronic obstructive lung disease. And basically, the definition of a chronic disease is a condition which once you have, you're probably going to have for life. Uh, so if you take diabetes, for example, once people are diagnosed with diabetes um, and they have to start treatment, most people are probably going to have to be on diabetes treatment forever. We know this is true of type 1 diabetes, where if you get it in childhood and you have to start injecting insulin, you're pretty much injecting insulin for life. But this is also true for most people who get type 2 diabetes, which is the kind of diabetes that you get later in life, where again, once you are diagnosed and once you start the treatment, you probably have to be on treatment for the rest of your life because although the treatment is going to help you control your diabetes, it's not going to cure your diabetes. And there are lots of chronic diseases that we deal with in medicine where we have treatments, but the treatments only work for as long as you do the treatment. You stop the treatment, the problem comes back. Another good example would be high blood pressure. Most people, when they have high blood pressure, they have to start taking medication, and that brings the blood pressure down. And then in most cases, the blood pressure stays down as long as people continue taking their medication for blood pressure. When you stop taking your medication, the blood pressure goes back up. And that's why you call it a chronic disease, because all of these conditions need long-term treatment. Now, when it comes to obesity, most people don't think of obesity as a chronic disease. Most people don't think of obesity as being a condition that you're going to have for the rest of your life. Most people think that if I could just lose the weight and maybe I can lose the 20 pounds or 30 pounds or 40 pounds and I can go on a diet and I can do my exercise and I can get the weight down, then I've solved the problem. Unfortunately, and most of you who've lost weight before probably know this, that's not how bodies work. That's not how obesity works. Usually, in most cases, once you gain weight, you are going to have problems with your body weight pretty much for the rest of your life. And here's what I mean by that. Uh, we all know that obesity develops when people's body weight increases and they have more body fat, and that body fat then can start affecting their health. It starts, increasing their risk for diabetes. It can cause the blood pressure to go up, and there are many, many health problems that are related to excess body fat. And there are many reasons why people could gain excess body fat. And I just want to look at a couple of examples. I mean, it all starts with genetics. Very often we find that obesity runs in families. You look at the parents, you look at the grandparents, you look at the sisters. I ask my patients, is obesity on your dad's side or your mom's side of the family? And very often it's on both sides. And so it starts with a lot of genetics. And what the genetics does is it makes you more likely to gain weight, which means that if you have the genes that allow you to have obesity, you are much more likely to gain weight, especially in the kind of environment in which we live today, where most of us are not very physically active. We are surrounded by food all the time. The quality of the food is not very good. So when you live in that kind of an environment and you have the genes that allow you to gain weight easily, then you're much more likely to end up having obesity at the end. That's the genetic part. But there are also many other causes of obesity. We know, for example, that there are lots of mental health issues that can promote weight gain. Just to give you one example, we know that people who have depression are much more likely to gain weight, and that is because depression does not just affect your mood, but as we know today, depression also affects your metabolism, it affects your energy levels, it affects your appetite, it affects your physical activity, and it changes your metabolism. And so people who have depression are much more likely to gain weight. We know that people who have anxiety disorders are much more likely to gain weight. Why is that? Because when you're anxious, means your body is in a constant state of stress because you're worrying about things all the time. Every little thing upsets you. Uh, you just worry a lot. Uh, that increases your level of stress hormones. And when your stress hormones are up, again, it's much easier for your body to gain weight. Those stress hormones, you think of hormones like cortisol, they increase your appetite, and they make it much easier for your body to gain weight and accumulate that fat. Uh, let's take another example. Let's take attention deficit disorder. When people have attention deficit disorder, uh, you're much more impulsive, which means that your control over your food intake is is much less because you're very impulsive. You don't have regular meals. You're skipping meals. You try diets, but then you don't stick with them because that's what attention deficit disorder is. And so we see that a lot of people with attention deficit disorder have problems controlling their weight. We know that there are addictions. There's even food addiction. We know that a lot of adverse childhood events, and this is very relevant, that when people experience trauma, this could be early in childhood, but this could also be later in life. When people experience trauma, that has significant effects on metabolism, on behavior, on appetite, and in extreme forms, trauma can lead to pathological eating behavior. So there is a condition, for example, called binge eating disorder, which you typically find in people who've had traumatic experiences. Now, this could be all kinds of traumatic experiences. This could be emotional neglect. This could be the fact that someone is being bullied or teased about their size or their appearance. You might grow up in a family where there is a lot of mental abuse. People might have sexual assault or sexual molestation histories. Sometimes it's just grief. You just lost somebody very close to you and that's affecting you. And so any kind of trauma can lead people to start using food as a coping strategy. And what that basically means is they lose control over their eating. So they feel sad, they feel bored, and they eat too much. So the point here is that there are many, many different reasons why someone might end up putting on weight. If you live in today's environment where you're constantly surrounded by food and it's not always good quality food, you live in a culture where everything is celebrated with food, everything revolves around food, whether it's Thanksgiving or Christmas or a birthday party or a wedding or a funeral, there's always food. And it's not always healthy food. And on top of that, you live in an environment where you really don't have to be very physically active. I mean, you can choose to be physically active, but you know what? Some people enjoy being physically active, and a lot of people don't enjoy being physically active. So, and if you have a busy job, if you're a truck driver, or if you have a desk job, or you're sitting in front of a computer all day, you might not get a lot of physical activity. And then, of course, we have high stress levels. And again, high stress levels means your stress hormones are high. And so when you live in that kind of an environment, you're much more likely to gain weight and have a problem with your weight. But here's the bottom line. At the end of the day, it doesn't matter because your body really does not care about why you put on the weight. And this brings us to a really important point. We often think about body weight as something that you should be able to control and that you have control over. So if you control how much you eat and how much activity you do, you should be able to be whatever weight you want to be. That unfortunately is not true because your body actively regulates your body weight. And what does that mean? Now, when we think about how bodies work, there are many things that bodies have to regulate in order for you to stay alive. Let's take, for example, your body temperature. Your body is going to keep your body temperature at 37 degrees. And it doesn't matter whether you're in a hot environment or you're in a cold environment or you open the window or you soak yourself in water, or on a hot sunny day, your body is somehow going to still keep you at 37 degrees. And in fact, if for whatever reason your body cools off, it's not going to take very long and your body temperature is going to come back to 37 degrees, because that's what your body does. Your body keeps your body temperature at 37 degrees. And you don't have to think about it, you don't have to plan about it, you don't have to worry about it. It's what your body does. And we call that homeostasis. So there are these complex biological processes that are going to keep your body temperature at 37 degrees. And even if you get cooled off, your body is still going to take you back to 37 degrees. Now, there are lots of things that your body controls. And I could give you a lot of examples. Blood pressure is another example. Your body regulates your blood pressure. You don't have to worry about it. When you have to work, your body needs a higher pressure. That's going to happen. Your body does it. You don't have to think about it. You don't have to worry about it. Blood sugar levels. For people who don't have diabetes, blood sugar is tightly controlled. You have a meal, the blood sugar goes up and then it comes down again because your body is controlling it. You don't have to think about it. That's what your body does. And that's homeostasis. Now, interestingly, when it comes to body weight, the same kind of rules apply. Your body also controls your body weight. And here's the problem. Your body tends to control your body weight and keep your body weight at the highest body weight that you've ever been, not counting pregnancies. So your body really does not care how you got to 200 pounds. There could be all kinds of reasons. We've talked about that. There could be all kinds of reasons why you went from being someone who was, 140 pounds when you were 20 to someone who's now 300 pounds at age 40. All kinds of reasons. But your body doesn't care. What your body, however, does care about is keeping you at 300 pounds. Because your body says, all right, we got to 300 pounds. Well, now this is your new normal. This is the weight that your body is now going to try to keep you at. And the body is very effective at doing that. So what happens? You're at 300 pounds. You want to lose some weight. You go on a diet. You start exercising. Maybe you start losing some weight. How does your body respond? Well, your body is going to respond by trying to keep you at 300 pounds. And so as you start losing weight, your metabolism changes, your appetite changes, and your body has a whole bag of tricks that's going to try to take you back to 300 pounds. And a simple result of this is the simple fact that most people, when they lose weight, end up putting the weight back on. And there's lots of research on this. All of the research shows that it doesn't really matter what kind of diet you go on. You can go on a ketogenic diet, you can go on a low carb diet, you can go on a high protein diet, you can go on a meal supplement diet, you can lose weight fast, you can lose weight slow. At the end of the day, most people who lose weight are going to end up putting the weight back on. And we call that yo-yo dieting. That's what happens to most people. Now, we all know some people who manage to lose a lot of weight and they manage to keep it off for maybe a couple of years. And we look at those people and they think they've conquered obesity. But the fact is that all of those people, if you talk to them, they have to constantly do something to keep their weight down. And the minute they stop doing whatever they're doing, and they could be running marathons. They could be counting calories. They could be, they could be on some kind of a special diet. They could be having a 4-hour workout every day. It doesn't matter. The minute they stop doing what they're doing to control their weight, guess what? The weight starts going back up and it goes back exactly to where it was before they lost weight. So how does the body do that? This is normal biology. If I try to lose 5 pounds, my body is going to want the 5 pounds back. At the end of the day, somehow my body is going to find a way to put the 5 pounds back on. So whether you're trying to lose 5 pounds and keep them off, or you're trying to lose 20 pounds and keep them off, or you're going to try to lose 100 pounds and keep them off, you are going to be fighting your body that is going to try to defend its body weight And if you somehow do manage to lose the weight, your body is going to do whatever it can to put the weight right back on. And that's the dilemma that anybody is up against when it comes to weight management. And again, it doesn't matter why you put on the weight in the first place. All your body is going to care about is defending your body weight and trying to keep you at that highest weight that you've somehow got to. And unfortunately, that's not something we can change. So so what is it that the body can do to defend its body weight? And many of you might have experienced this. When you start out on a diet, you start losing weight, and the first few days or weeks on the diet, your weight's going down, things are going well. And then you hit a plateau. And now you're still doing your diet, and you're still doing your exercise, and you're still doing everything right. And you've already lost 30 or 40 pounds, but now you find you're not losing any more weight. Well, because your body has now, got its act together and is going to, and has gotten really good at defending its body weight. So now you hit the weight loss plateau. If you want to go beyond the plateau, you're going to have to do a lot more work. And unfortunately, what this means is that, losing the first 10 pounds is easy. The next 10 pounds is going to be harder. You want to lose another 10 pounds, that's going to be even harder. And ultimately, you're really fighting hard, but your body's not losing any more weight. And that's when people get frustrated. That's when people get fed up. That's when they say, my diet is no longer working. And then they stop. And guess what? All the weight they've lost just comes back. That's nobody's fault. That is normal biology. That's how bodies work. So how does the body defend against body weight? And why does the body put the weight back on? So what actually happens? And now we understand today, and there's a lot of research on this, showing that, as I said, your body weight is tightly regulated. So your body has a whole bag of tricks that it can use to try to stop you from losing weight. And if you somehow trick your body into losing weight, these mechanisms are going to make it, they're probably even going to guarantee that the weight comes back. So what's the first thing that happens? Well, the first thing that happens when you try to lose weight, and you try to lose weight by eating less, just eat less. That's what everybody tells you, just eat less and you lose weight. Well, guess what happens? As you start losing weight and you eat less, you get more and more hungry. And a lot of people who've been on diets know this. As they start losing weight, the first couple of days, the first couple of weeks are fine, but then as you start really losing more and more weight, you start getting cravings. You start feeling more and more hungry. Your appetite increases. Suddenly you're starting to think about food all the time because your body is looking for food. That is a completely normal response, because if you're not eating, then your body is going to make you want to eat. So now you're starting to think about food all the time, and and you might even start thinking about foods that you normally don't even like. Like you might be somebody who doesn't like pizza, never eats pizza, hates pizza. But guess what? As you start losing weight, suddenly you start thinking about pizza. Because why? Your body knows that's where the calories are. So that's one thing that happens. And a lot of people have experienced this. And they tell me, doctor, when I stop eating certain things, I start thinking about those things, and it gets harder and harder for me. I suddenly get all these cravings. That's appetite. But here's another thing that happens. Now, the reason we need calories is because our body needs calories. Because just being alive means you're burning calories. Even when I'm just sitting here talking to you, I'm burning calories, right? My heart is beating, my brain is working, my kidneys are working, my liver is working, all of these organs, they're all using calories to keep me alive. And what happens to the amount of calories that your body needs as you start losing weight is that your body starts reducing the number of calories that you actually need for these functions. So normally, we say somebody needs about 1,400 calories a day, and that's just being alive, right? 1,400 calories roughly is the amount of calories that most adult people kind of need just to stay alive. That's your heart beating, your brain working, your body doing what it does. And you need 1,400 calories a day to do that. But here's the thing. as you start losing weight, guess what happens? Your body is now adapting to the weight loss, and it starts reducing that number. And so a couple of weeks into your diet, or as you've started losing weight, your body is doing all the same things. Your heart is beating, your brain is working, your digestive system is working, but it's doing so on fewer calories. And you can actually measure that. And we know that, even a 5 or 10% weight loss, so if you're 200 pounds and you lose 5%, that's a 10-pound weight loss. Already your body has reduced the number of calories it actually needs. It has become, if you want, more fuel efficient. So what does that mean? Well, now that your body needs fewer calories, what it means is when you start adding calories back into your diet, your weight's going to go right back up to where you started. But it's not just the calories that you burn when you're sitting there doing nothing. That's your resting metabolic rate. What also happens, unfortunately, is that as you start losing weight, even the calories that your body needs for being physically active reduces. So let's say, you go on a treadmill before weight loss, and you're on the treadmill for, 40 minutes, and you burn 200 calories. Well, that's before weight loss. Now you lose weight and you get on your treadmill and you go for 40 minutes and you're no longer burning 200 calories. Now you're burning 150 calories because your body's become more fuel efficient. So now you can do the same amount of physical work on fewer calories. So you've got three things that happen. Your appetite goes up, your resting metabolic rate goes down, and even the amount of calories that you burn when you're physically active goes down. And this puts you in a situation where your body is trying to stop you from losing more weight by doing all of these things to you. And at the same time, your body is setting you up for weight regain. Because the fewer calories you need and the more you're craving food, the harder and harder it gets to keep the weight off. And ultimately, people give up. They go off their diet. Maybe they cut back on their exercise program. The weight goes right back to where you started. That is normal physiology. That happens to anybody who tries to lose weight. And we can measure all of this. And we actually understand the neurobiology of how this works. And that's why most people who lose weight just end up putting the weight back on. And that's what the problem is that you're up against when we try to manage weight. Now, unfortunately, as I said before, your body tends to defend the highest weight that you've ever been at. And for most people, that's true. And this means that once you get to a weight that we would consider, obesity because it affects your health, unfortunately, that now becomes the weight that your body wants to be at. And your body doesn't care whether you have diabetes or back pain or your knees hurt or you have sleep apnea or your blood pressure high. The parts of your brain that control your body weight, they don't care about any of that. All they care about is keeping you at 300 pounds. That's what that part of the brain cares about. And you don't have to think about it. It's like your body temperature. You don't have to think about it. Your body is going to work, and it's going to do what it can to stop you from gaining weight. And if you do manage to lose weight, stop you from losing weight. And if you do manage to lose the weight, it's going to take you right back to where you started. And so what I often tell my patients is that anytime you lose weight, it's always like you're pulling on a rubber band. Your body wants to be up here somewhere, 300 pounds. And you're like pulling on a rubber band trying to get down. And you get down and you're exercising and you're losing the weight. And then you let go of the rubber band. Guess what? Boom, you go right back to your 300 pounds. Very depressing. But that, unfortunately, is exactly how bodies work. That's how my body works. That's how your body works. That's how your pet's body works. Like if you have a dog or a cat at home, their body weight is being regulated. You put your cat on a diet and your cat loses weight, and then you take your cat off the diet, guess what? The weight comes back. Because that is how bodies work. And that is fundamental to understanding, because we do not know how to change your body from wanting to be 300 pounds. Once you get to 300 pounds or 400 pounds or 250, whatever the number is, and that becomes the weight that your body wants to be at, there is no way that we know of to change that. And that's when obesity becomes a lifelong problem. And that's why we say obesity is a chronic disease. So what does this mean for treatment? Well, the first thing this means for treatment is, or for managing obesity is, don't get any heavier. If the heaviest you've ever been in your life, say, has been 250 pounds, and 250 pounds is where your body wants to be at. That's always the weight that you come back to every time you go on a diet. You come back to 250. So if that's the weight that your body wants to be at, well, the first thing you want to do is you never want to get heavier. Because if you put on more weight, say you get to 300 pounds, well, now 300 pounds becomes the new weight that your body wants to be at. And now you're fighting 300 pounds. And if you get to 350 pounds, now you're fighting 350 pounds. So the problem keeps getting worse every time you get to a new highest weight. So the first thing you want to do, if you say you're at 250 pounds, is don't get heavier. Right now you're fighting 250, which is maybe bad enough. You don't want to get to 300 because then you're fighting 300. Okay, so rule number one, whatever the highest weight is that you've ever been, again, not counting pregnancies because pregnancies are special, you never ever want to go above that highest weight, because then that new high weight might become the new normal. And that's then a problem. Okay, I see a question here from Tanya. Tanya, you want to ask the question? If you just type it in, I'm going to see if I can see it here somewhere. I don't see. Oh, here I see the questions. Okay, Tanya, you want to type in your questions? All right. While we're waiting for Tanya to ask her question, let's continue here. So the rule number one is, whatever your highest weight was, let's make sure that's the highest weight you'll ever be. Okay? Because the problem can always get worse. And unfortunately, that's true for any chronic disease. Chronic diseases, they usually can get worse. They don't often get better, but they always get worse. Obesity can get worse. Okay, I'm trying to look at the question here. I see Tanya is still typing, so we'll wait for Tanya to come up with her question. Okay, so rule number one, don't get heavier. Rule number two, whatever it is that you're going to do to lose the weight, if it works for you. And there's all kinds of strategies, and we can talk about the different strategies on how you lose weight. But whatever you do to try to lose weight, remember, you're always pulling on a rubber band. And if you want to keep the weight off, you're going to have to keep pulling. Right? There's no magical diet that you can go on for 6 weeks and it's going to change your metabolism, and after that you can go back to living happily ever after, and somehow magically the weight is gone and you're going to stay at that lower level forever. That does not happen. So the rule here is that whatever it is that you're going to do to lose weight has to be something that you can keep doing pretty much forever. So what this means is that if you're going to go on some kind of crazy diet, it's some kind of a milk, some kind of a shake or something extreme where you're completely eliminating a certain food and you're trying really hard and you actually manage to lose weight, guess what? Then that is the diet that you're going to have to live on for the rest of your life to keep the weight off. Because the day you stop that diet, guess what? The weight is going to start coming back. Or you want to start some kind of an exercise program. You're going to start spending 3 hours in the gym every day trying to get the weight off. And let's say that works for you. How do you keep the weight off? Well, you continue spending 4 hours a day in the gym every single day, and that's going to help you keep the weight off. If you want to manage your weight by running marathons, be my guest. But the only way you're going to keep the weight off is when you continue running marathons. If you get an injury and you decide, you know what, maybe I'm going to stop running my marathons, guess what? Your weight's going to come back. So what this means for obesity management is we have to find a way for you to manage your weight that is sustainable and that you can keep doing forever. And that's where things get complicated. Okay, so now I'm looking at Tanya's question here. All right, so this is a question about being at menopause. Now, it's a little side story here. We've already talked about the fact that there are many reasons why people gain weight. Now, there are also biological times, uh, both in a woman's life but also in a man's life, when you may be more susceptible to weight gain. One of them is puberty. For a lot of women, as you enter puberty, now that's 9 years old, 10 years old, some people sometimes now it's even 8 years old, you actually start finding that your weight starts going up. Puberty is one of those periods where your weight can go up. Pregnancies is another period where your weight goes up. Normally what happens in a pregnancy is you get pregnant, you gain weight, you deliver the kid, the weight comes down, you're good. But sometimes the weight that you gain during pregnancy, you don't lose that weight. And it stays on, and then that becomes your new weight. Okay, so pregnancies is also a time where you have to be really careful about how much weight you put on. Because if that weight sticks after the pregnancy, then you're going to be at a higher weight. And another period for women is menopause. As you enter menopause, again, there are lots of changes, lots of hormonal changes that can cause weight gain. And again, once you get to that higher weight, then that becomes the new weight that your body wants to be at. And so now that you've gone through menopause and your weight has gone up, maybe 10 pounds, 20 pounds, you might be stuck with those extra 10 or 20 pounds just because that's become your new weight. So there are these times where you have to be really, really careful in terms of weight gain. And if you're starting to see, well, the weight is really coming on, you got to look at, well, what's causing the weight gain? Maybe now's the time to actually try to stop that weight gain from happening. And remember, stopping weight gain is different from trying to get weight loss, right? And we can talk about it. Well, I want to go back to the whole issue around managing, managing your weight in the long term. So when we think about all of the research that has been done on people trying to lose weight and keeping it off, what the research shows is that if you're trying to lose a small amount of weight, 5%, which means that if you're 200 pounds and you're trying to lose 10 pounds, well, that, there's a good chance you can lose the 10 pounds, but there's also a very good chance you can keep the 10 pounds off. Because remember, the rubber band, right? 10 pounds is this. Like you're pulling this much. Now, that much pull you can probably sustain, because you got to make a few changes. You make those changes, maybe, whatever it is. Well, that's only a 10-pound weight loss. That people can do. 5% weight loss is usually what people can do. So what the research shows is that when you take people and they try to lose weight, if 2 years later they're still about 5% below where they started, they've actually done pretty well. That on an average is what behavioral intervention for obesity gets you. Now, some people do a lot better because they're not pulling here, they're pulling here. They start running marathons. They start spending 4 hours a day in the gym. They start a restrictive diet. Great. If that's what they want to do, maybe they'll get more. For most people, when you make changes that are sustainable, a 5% weight loss kept off over 2 or 3 years, you've done great. And there are lots of health benefits for that. But you know what? For many people, for many of the patients who come to see me, that 3 or 4 or 5% weight loss, a 10-pound weight loss is not going to cut it. A lot of these patients are probably going to have to make much bigger changes, are probably going to need much more weight loss, especially if you have conditions like sleep apnea or if you have osteoarthritis. You're going to have to lose a lot more weight for those things to really start getting better. So now what do we do? Well, we've got to find a treatment option that people can stay on. Now, one of the treatment options that people can stay on, and this is probably the most drastic treatment, is bariatric surgery. Now, when I say bariatric surgery, this is not Mickey Mouse surgery. Bariatric surgery is major surgery, right? I mean, there's different types of surgeries, and we don't have to go into all of the different types, but one thing we know for sure about bariatric surgery is that for most people who have surgery, it works. And it works in the long term. We now have 20 and 30-year studies on bariatric surgery showing that most people who have bariatric surgery, even 20 or 30 years, are still below the weight where they started off at, usually about 20 or 30% below the highest weight that they were at before they had surgery. And I'm talking about 20 and 30-year studies here. And we know that as a result of that, usually their health gets a lot better. Now, this is not to say that surgery is an easy solution because for one, we're talking major surgery. This is, like I said, this is not Mickey Mouse surgery. This is serious surgery, and serious surgery can always have complications, and there are patients who don't do well after surgery. And I often tell my patients, when you think about surgery, you still have to remember the rubber band. You still have to remember that your body is going to want to take you back to the weight that you started at. And what surgery does is it reduces the tension in the rubber band, so now you can lose more weight, and you have a fighting chance of keeping the weight off, but it's still a rubber band. And so if you're not fighting after surgery to keep the weight off, your weight is still going to go back to where it started. And we see this happening, unfortunately, in people who've had bariatric surgery. They have bariatric surgery, they lose the weight, 5 years later, weight's back. And that's because it's still a rubber band. Their body still wants to be where they started, right? So for them, that's like going on another diet. Fortunately, most people who have bariatric surgery, that's not what we see. Okay, but we do see people where the weight just comes back and then they're where they started. Okay, so it's not a treatment that needs to be taken lightly, and it's definitely not an easy treatment, but it is an effective treatment, and it's a treatment that can work for many people. Okay, but not everybody wants surgery, and not everybody needs surgery. Now, between the diet and exercise, so we're talking 5% weight loss, and we're talking bariatric surgery down here, that's 20% weight loss, we don't have a lot of other treatment options. Fortunately, in Canada now we have a few medications, and when I say medications, I'm talking prescription medications. These are not things you can pick up in the pharmacy that, they say metabolic booster or colon cleanser or, calorie burner or whatever. I'm not talking about that nonsense that you can buy, none of which works. What I'm talking about is prescription medications for obesity, prescription medications that have been tested, where we have large clinical trials with thousands of people, where Health Canada has looked at the data and says, okay, this is a drug that's effective and that is safe, right? Because long-term safety is a huge question about any drug that you're probably going to have to take for a long time. So those are all important questions. So when I talk about obesity medication, I'm not talking about something you can just pick up in the pharmacy. No, I'm talking about the medication where you actually need to go to see a doctor, and your doctor has to then see if this is the right one for you, and they have to write your prescription, and then that's how you get it. So fortunately, now we're starting to see a few medications for that. They're not as effective as bariatric surgery. So again, if bariatric surgery gets you 20%, well, the medications maybe get you 10%, 15%. That's still better than just diet and exercise, but it's not quite bariatric surgery. But for some people, maybe that's enough. But here's where we come back to the whole issue around chronic disease. Whatever treatment it is that you're going to do for obesity, whether this is going to be diet and exercise, whether this is going to be counting your calories, whether this is going to be keeping a food journal, whether this is going to be taking a medication for obesity or having bariatric surgery, you are going to have to stay on that treatment pretty much forever, because the day you come off that treatment, guess what? Your body is going to go right back to where it started. So stopping your medication for obesity is like stopping your medication for diabetes. If you have diabetes and you have to take medication for diabetes every day, and you stop taking those medications, guess what happens? Well, your blood sugars are going to go up. Why? Because you stopped the treatment. When you have high blood pressure and you take your blood pressure pills every day and your blood pressure comes down, what does that mean? Well, that means you need to keep taking your medication, because when you stop your medication, guess what? Your blood pressure goes back up. Why? Because you stopped your medication, you stopped the treatment. Treatments only work when you take them or when you do them. And so the challenge in obesity management is not so much how do I lose weight. Lots of ways to lose weight. The question is, how do I keep the weight off? And that's where you have to have a strategy to say, okay, well, what is your strategy for after you've lost the weight to keep the weight off? And that's where we've learned a lot from a lot of research here, that saying that trying to do this with willpower alone is not going to work for most people. Why? Because you are fighting your body that's constantly going to try to keep, to sabotage you and put the weight back on. And that's where this becomes a lifelong battle. So I've been doing this for a while, and I've seen a lot of people who've lost weight. I've seen a lot of people who've had bariatric surgery. I've seen a lot of people who are being treated with medication for obesity, and their weight is down, and they're keeping the weight down because they continue taking their medication. But I've never seen anybody who's been cured of obesity. What do I mean by cure? Curing a condition means that you get a condition, you do a treatment, the condition gets better, you stop the treatment, and the condition is gone. An ear infection, that's an acute condition. You get an ear infection, you take an antibiotic, the ear infection goes away, you stop the antibiotic, and your ears are fine. You might never get another ear infection. That's an acute problem with an acute treatment. Obesity is not like that. We do not cure obesity. We manage obesity, we treat obesity, but for most people, it's a lifelong condition. Now, this does not mean that everybody has to take medication. This does not mean that everybody needs bariatric surgery. No. If you can use behavioral strategies that'll help you lose weight and keep the weight off in the long term, well, then maybe that works for you. But what we do know is the more weight you're trying to lose, the harder this gets. Because the more drastic the changes are that you're going to have to make, and the more drastic the changes are, the harder it gets to sustain those changes. And so when we recognize that obesity is really like every other chronic disease, rule number one, we don't want it to get worse. So whatever is causing the weight gain, let's look at that. Let's try to figure out why are you gaining weight. And then maybe we can change that, and then you stop gaining weight, and that's already success. I tell this to a lot of my patients. Yeah, I know you're at 300 pounds now, but you know what? If you can come back in 10 years and you're still only 300 pounds, that's a tremendous success. Because even not getting heavier means you're going to have to do something. Because if you keep doing what you're doing now, well, guess what? You're just going to keep getting heavier, right? So the first sign of success in obesity management is when people stop gaining weight or gaining less weight than before. So it's not just the weight loss, no. For some of my patients, that's the best we can do. They're 200 pounds now. 5 years from now, they're still 200 pounds. Fantastic. Right? Why? Because, hey, we've kept you at 200 pounds. Would that have happened had you not come to see us? Had you not done what it is that we recommended for you to do? No, you'd probably be 250 by now. Okay, but you know what? You managed to be 200. Now, I know that there's a lot of people out there who they're not happy with their weight. For some reason, who knows why, they got to 200 pounds. But here's the good news. They've been at 200 pounds for the last 10 years. That is actually pretty good. Because it means whatever was causing weight gain is no longer causing weight gain. You're now at 200 pounds. You may not be happy at 200 pounds. You don't like 200 pounds. Maybe 200 pounds is causing you all kinds of problems. But your weight is under control. Because if it was not under control, well, then you wouldn't be at 200 pounds. Your weight would have continued going up, and it would have gone up to 250, and maybe you would have been 300 by now. Who knows? Okay? So we've got to think about obesity in the same way that we think about someone who's got heart disease, someone who's got diabetes, someone who has high blood pressure, someone who's got chronic asthma, someone who has chronic depression, that these are all chronic conditions that we don't know how to cure, but we know how to manage them. And so when we talk about obesity management, we're not talking about curing obesity. We're not talking about permanent weight loss. No, we're not. We're talking about trying to improve your health using a strategy that is going to be sustainable. And everyone is different. Things that work great for one person don't work great for another person. Maybe there's a diet that works great for you. Now your friend goes on the same diet, they lose no weight, or it doesn't work for them. And that's the same for everything. That's the same is true for medication. Some medications work great for some people, and other people take the same medication, doesn't work for them, or they don't tolerate it. Bariatric surgery, same story. It works great for some people, doesn't work at all for other people. But again, that's not different from other chronic disease. If you take diabetes, we've got so many different treatments for diabetes. Some treatments work great for some people, and other treatments work great for other people. High blood pressure. Not everybody takes the same pill for blood pressure. No, there's lots of different medication for blood pressure. Some people take some medication that work for them, and other people take other medication, and that works better for them. Take depression. Now, some people, take one drug, and that works for them, and other people take another drug, and that works for them. And if they try taking the same drug, it wouldn't work for everybody. So a lot about obesity management is about trying to find a way based on your situation, based on what else is going on in your life, that's going to help you manage this condition. Because all I can tell you is, once you have obesity, you're going to be living with obesity pretty much forever. Even if you lose the weight, you're still someone who's living with obesity, because you still have to live as someone who has a chronic disease. And a lot of people don't get this. So let's take someone who's got high blood pressure. That's someone who has hypertension. And now I give you a pill, and you take the pill, and your blood pressure comes down to 120. That's normal. Are you still someone who has hypertension? Of course. Yeah, you're now someone who has treated hypertension, but if I stop the pill, your blood pressure is going to go back up. And so you're still someone who has hypertension. Now your hypertension is treated, it's controlled, your blood pressure right now is normal, but you're still someone who's living with hypertension. You could say the same for someone with diabetes. If you have diabetes and now we treat your diabetes and you're taking your insulin injection and your blood sugar is well controlled, are you still someone who has diabetes? Of course you're still someone who has diabetes. Why? Because you're someone who's living with diabetes. Your diabetes is being treated and it's being controlled, and even though you might not have high blood sugars right now, that doesn't mean you don't have diabetes. No, you still have diabetes. Just that your diabetes is now being managed. And the same is true with obesity. Now you might have had bariatric surgery and your weight has now come down to, say, 140 pounds. Well, that's great. Do you still have obesity? Yeah, you still have obesity. Why? Because now you're somebody whose obesity is treated and someone whose obesity is controlled. But guess what? If you went back to the surgeon and told the surgeon, hey, Dr. Surgeon, can you reverse the surgery? Guess what? Your weight would go right back to where you started. So even though you are now someone whose weight is come down, you're still someone living with obesity. And that's really important to recognize, that when we talk about chronic disease, things are not hopeless. Most chronic diseases, for many chronic diseases, we have good treatments. And when you have those treatments and you manage those conditions with those treatments, people can live long lives. We do this for people who have diabetes all the time. We do this for people who have high blood pressure all the time. Unfortunately, we are not doing this for people who have obesity all the time, because most people have not looked at obesity as a chronic disease. They look at obesity as simply as a lifestyle problem. I just need to get my act together. I need to start an exercise program, and somehow magically I'm going to lose the weight and the problem is gone. Unfortunately, that's not what happens with obesity. In the same way that that's not what happens with diabetes, that's not what happens with high blood pressure. So when we start thinking about obesity as a chronic disease, a lot of things start making sense. The fact that every time you lose weight, the more weight you lose, the harder it gets to keep it off. Right? Starts making sense. Well, you're talking about a chronic disease here. Right? The yo-yo dieting that keeps happening to everybody. So we need to start thinking about those treatments, and we need to start thinking about how do we make those treatments accessible to patients living with obesity. And unfortunately, Obesity Canada published a report card on obesity management 2 years ago, and we know that the situation is not good. Most patients cannot find the help. They cannot find the people, the qualified doctors, nurses, dietitians who can actually help them manage it as a chronic disease. In fact, most of these doctors and health professionals don't even look at obesity as a chronic disease, because that's not what they were taught in medical school. And so we have to change that. And that's really what Obesity Canada is working about, trying to change our understanding of obesity based on the best available science. And I'm quite sure that we are going to see more and more treatments become available, and we're going to start learning how to use those treatments. And we may not be able to cure obesity, which, by the way, really means that we have to get serious about preventing obesity, because once you have obesity, you're pretty much stuck with it forever. And so it's not something you want to get, which means we have to think seriously about prevention. So I'm going to stop here. I hope I've made it clear why the World Health Organization, Obesity Canada, the Canadian Medical Association, the American Medical Association, all of these organizations are now coming out and saying obesity is a chronic disease. We have to look at obesity as a chronic disease. We have to prevent obesity because it is a chronic disease. and we have to start managing obesity as a chronic disease. And we're not going to do this with shame and blame and quick fix solutions and drastic diets, and none of that is going to help. It's just like every other chronic disease. We have to figure out how are we going to manage this, and hopefully health systems are going to start offering treatments for obesity in the same way that they offer treatments for diabetes and heart disease and every other chronic disease that's out there. So I'm going to stop there. I'm going to, we have a few minutes for a couple of questions, and I'm just going to see if any questions have been typed, and then I'll try to answer as many as I can.
We've got a question up there from Marvin.
Okay.
So, who wants to know about the moderate to severe binge eating disorders.
Great. Yeah. So we have a question here from Arvin, who's talking about binge eating disorders. So now binge eating disorder is actually a psychiatric diagnosis, and what it really means is, what's a binge and what's not a binge. Eating too much is not a binge. If I don't eat all day because I'm too busy and I come home in the evening and I'm starving and I walk straight to my refrigerator and I open my refrigerator and I eat all the food in sight because I'm starving, that's not a binge. That's eating because I'm hungry. And when people are hungry, you tend to overeat because you're eating too fast. You go for food that's maybe not the healthiest food. You eat very fast. You eat a lot of it. And you might end up feeling too full. And you might feel frustrated that you've done it, but that is actually a very normal response. If you lead a starving person, to a pantry, they're going to eat all the food. That's normal. That is not a binge. When we talk about binge eating disorder, we're talking about a disorder where you're eating a large amount of food, but not because you're really hungry. It's not physical hunger. In fact, you could have had a very nice breakfast, and you're not hungry at all, and then the kids go out of the house, and suddenly you feel like you got to eat. And then you go to your fridge, or you go to the pantry, and you start eating stuff. And then you eat a bit of something and it doesn't really satisfy you, and then you eat something else, and then that doesn't satisfy you, and then you eat something else, and that really doesn't make you happy, and you're eating all this food not because you're hungry, but because you just feel like you have to eat it. And here's the important thing. When you're hungry and you eat, you actually feel pretty happy, because now I'm happy. I'm happy that I ate all that food because I'm satisfied. I was hungry. I've eaten. I'm full. Okay, it might not have been the best food, but you know what? I had to eat. I was hungry. Okay. A binge is very different. You're not eating because you're hungry. You're eating because you want food. You're craving food. Not because you're hungry, not because your body needs those calories. No, because it's an emotional thing. And so you're eating all this food, and you can't seem to control yourself. And here's the big difference. As you eat the food, or even after you've eaten the food, you really don't feel good about yourself. And you're asking yourself, why did I do this? I hate myself for doing this. Oh, here I've gone and done it again. And it does not make you happy. In fact, it makes you feel worse. So emotionally, that binge is very different from eating too much when there's a celebration, there's lots of food on the table, and you're just eating because there's food and you enjoy food, and it makes you happy. That's not a binge. So when we talk about binge eating disorder, we're talking about a very specific psychological, psychiatric disorder, which tends to happen more commonly in people who have experienced trauma. And it's all kinds of trauma. Like I said, this could be emotional trauma, physical trauma, sexual trauma, it could be grief, it could be other stuff. You have to think of binge eating as an extreme form of emotional eating. Now, we also have emotional eating, which is people just eating because, hey, I'm not happy, I'll eat a piece of chocolate, it'll make me happy. Yeah, why? Because chocolate acts on your brain. It's like, it stimulates the parts of your brain that make you happy. Or, people eat because of emotion all the time. But, some people eat when they're stressed, they eat when they're bored, they eat when they're happy, they eat when they're sad, they eat when they're frustrated, they eat when any emotion can make people eat. Okay, that's emotional eating. That's a different thing. That's also not binge eating disorder. Okay, binge eating disorder is an extreme form of losing control over your food intake and eating large amounts of food, even though you're not hungry, and even though eating that food is not making you feel better. I hope that makes sense. And that's and people need help. People who have binge eating disorder, you got to find a psychiatrist, a psychologist, someone who understands binge eating disorder. Uh, we now have some medication for binge eating disorder, but the most important thing about binge eating disorder is making the diagnosis. And once you've made the diagnosis, then you find the proper treatment for this. It's not something that tends to go away on its own. Most people who have binge eating disorder, they've had it for years and years and years and years. And there are sometimes times where it gets worse and sometimes times where it gets better. But it's something that has to be looked at by someone who really understands this problem. Okay, let's take another question.
One here from Ken. Does the sleeve surgery increase reflux symptoms?
Okay, so there's a question here from Candace about whether obesity surgery increases reflux disease. So reflux disease, that's when you have acid from the stomach coming up, and heartburn. It's when you get heartburn. So a lot of people with obesity have heartburn, and that has a lot to do with the fact that when you have obesity and there's a lot of pressure in your abdomen, you get more reflux disease, and so people end up having a lot of heartburn. But we also know that there are certain types of bariatric surgeries. And the typical one here is the so-called sleeve gastrectomy. So the sleeve gastrectomy, I don't want to get into the details about the different types of surgery, but this is a surgery where basically they reduce the size of your stomach. Unfortunately, that one of the common problems with that type of surgery is reflux disease and heartburn. Often it can be managed. You treat it the same way that you treat heartburn in people who don't have bariatric surgery. You give them a tablet you give them medication that stops acid production. A lot of you listening here are probably on those medications. And for many patients, that medication then helps and they stop having heartburn. But it does happen, and it can be a significant problem for some people after that type of bariatric surgery. Other types of bariatric surgery may cause other problems, but sleeve gastrectomy, typically, heartburn is one of the problems that people might experience. Take another question.
Do you want to address what we can do across the country to cover the cost of weight loss medication? What's available?
Yeah. Well, the first thing we want to do across the country is making sure that health professionals, policymakers, and people living with obesity themselves all understand what the real problem is. The real problem is that once you get obesity, and it doesn't matter why or how you got obesity, it's not a question of whose fault this is or who we blame or shame about it. No, once you have obesity, you are going to need some form of support in order to manage your obesity for the rest of your life, pretty much. Okay? So we need people to understand that. And we need health systems to understand that. We need doctors to understand that. We need simply telling people to eat less and move more for obesity. That's like telling someone with depression, you got to cheer up. There was the old days, we used to try to talk people out of depression. Right? They would come with depression, and then you would meet a psychologist, and we would talk about, how things really aren't all that bad and how you can reframe things so that we will talk you out of your depression. Well, we realized that doesn't really work for most people, right? Because we know that depression is very often chemical in your brains, and you might need more treatment than that. We have to recognize that you cannot talk people out of their obesity, right? This is not about motivational, if I can just get my patients to all stop eating and exercise, we would solve the obesity problem. That's nonsense. That's not what the science shows. What the science shows is that even when you do that and people go and lose weight, most people are going to put the weight back on. That's what the science shows. So we've got to change our thinking about how do we approach this problem. And the solution here is we've got to approach obesity like every other chronic disease. And here's the good news. We know how to do chronic disease because we do it for every other chronic disease. So we've got to talk to our politicians. We've got to talk to our medical professionals. We have to talk to our payers. And patients living with obesity need to understand what the science of obesity actually teaches us about obesity and what the problem is that we're up against. And that's when we can start finding solutions. And that is exactly what Obesity Canada is trying to do. So when you look at all of the work that Obesity Canada is doing across the country, educating health professionals, advocating for better access for treatment, advocating for teaching obesity to medical students and nursing students and dietitian students so that when they become health professionals, they actually understand what these issues are. Uh, Advocating for better coverage for medications for obesity, because why should your medication for diabetes be covered, but your medication for obesity is not covered? It makes no sense, right? Your medication for diabetes or for hypertension or for cholesterol or for depression is all covered. But now you want medication for obesity, it's not covered. Makes no sense. We know that bariatric surgery, although it's the most effective treatment, most people can't get it. Depending on where you live in Canada, you could be looking at a 5-year or maybe a 10-year wait before you get bariatric surgery, if it's even available in your province. That's not fair to people living with obesity, because here's an effective treatment, but you can't get it. So we need to start thinking about how do we make treatments that actually work accessible, and how do we stop blaming people and shaming people and expecting them to do something that we know does not work. We've got to stop doing that.
So Nadia has a question about how to, do you want to
I think we got
address
time for one more
Nadia's
question.
about how to help patients
We got
who
one
are
more
in the
question.
hospital because of their weight?
Okay, all right. This is a really, really important question. This one is about how do we help people who are in hospital for whatever reason, but are heavy. In fact, they might be so heavy that you can't do certain diagnostic procedures, you can't do certain operations, they don't fit in the MRI machine, and we see those patients. And those patients are not going away. They're there, they're in the system. So one of the things that Obesity Canada is doing right now, and has done, and you're going to see more of this, Obesity Canada has been working very closely with Alberta Health Services here in Alberta. And we've actually taken a whole hospital. This is the Medicine Hat Hospital. And over the last 2 years, Obesity Canada, Alberta Health Services, researchers from the University of Alberta, and of course people from the hospital have been working, trying to say, how do we design a hospital so that people with obesity, when they come to this hospital, for whatever reason, they could be in a car accident, they could have cancer, they could just be pregnant. When they come to this hospital, how do we give them the same treatment in the same respectful way with the right, professional attitude as we do for every other patient who walks into the hospital? And so this is a really, really exciting program, because one of the things that Obesity Canada wants to do is make sure that every health facility in Canada, every hospital, every doctor's office, every clinic, every walk-in clinic that you go to, you should be getting the proper treatment, irrespective of whether you are 150 pounds or 200 pounds or 300 pounds or 400 pounds. It should make absolutely no difference. Everybody deserves the best possible medical care. And so this is something that Obesity Canada is working on. And if you stay tuned, I'm sure you're going to hear a lot more about the bariatric-friendly healthcare practices and recommendations that are coming out from Obesity Canada.
Perfect. Awesome.
Okay, so I'd like to stop there. We're out of time. So thank you all for tuning in. I understand this is going to be archived somewhere, so if I was going too fast for you, apologies. Once it's online, you can go back and listen to it again. And if you do have questions, please send them in, and maybe we'll have a future opportunity to address some of those questions. So thank you all again for tuning in, and